Greetings, I'm Dr. Michael McClure and warmly welcome you to session 2 of my course, exocad from beginner to expert with dental implants. Allow me to introduce myself. I am a practicing wet finger dentist located just outside of Jacksonville, Florida in the United States. My journey with digital dentistry began in 2005 when I started using CEREC. I transitioned to Planmeca's E4D system, which I utilized for over half a decade. However, it was in 2016 that I discovered exocad, which is a truly transformative experience that accelerated my transition of my practice into one that was fully digital. In early 2021, I was awarded the prestigious Level 3 Independent Dental CAD Training Certificate from exocad. There's no better time to start doing digital dentistry than right now. Digital dentistry not only increases treatment efficiency and accuracy, but also ensures predictable results. With digital dentistry, we can achieve more at a reduced cost while delivering superior outcomes for our patients and clients. In session 1, I gave an introduction to the Dental DB, the database, and went over some basic features and indications of that software. And we showed how to create a new job, including how to change material and parameter settings. We then introduced the Dental CAD software. It's the second part of exocad, where I demonstrated some basic and advanced features of the user interface to include hotkeys. And we'll continue to go over that and drive those things home as we go through the different sessions. We went over using the wizard versus expert mode, and we'll certainly go over that more as time goes on. In lesson number 2, which is today, we're going to learn the process to create a proper job description and single unit implant restorations. We'll design a screw retained prosthesis with an angled screw channel. We'll also design a custom abutment and a superstructure in a single design session. And lastly, I'll show you how to make a screw retained crown on a custom abutment instead of a tie base. And that's otherwise known as a screw mounted crown. So let's get started. Looking at the Dental DB, I've already got it open. We're going to go ahead and load a case. Now I'm going to load a case that's a demo case. There's a lot of demo cases that you can load just in this section here. So I'm going to scroll down. I'm going to find a demo case of a custom abutment. Custom abutment sample. We'll click on that and we're going to load this case. Now, when you load a case in this fashion, not where the scans of the arches are already here, all the data is already in that file. We just opened up a case that was previously, the job was previously done. You'll see the models down here. And if you notice, I've got a scan body right here. Now, scan bodies are what we use in the digital world to give us the exact three-dimensional position of the dental implant relative to the scans of the patient, the intraoral scans or the model scans. You'll notice that there's some scan bodies back here for a bridge. We're not going to use that bridge today, and I've actually already deleted it out of the job order. So it doesn't pop up because I just want to do a custom abutment or a screw retained crown on tooth number 8. So I'm going to change some things here in this description. When I click on number 8, you'll notice that it had been previously selected for a coping. I don't want to do a coping. I want to do a monolithic restoration. So I'm going to go ahead and switch that to anatomic crown. On this side, they're asking, is this an implant-based restoration? And it is. So we can do a custom abutment, screw retained crown. We can do a crown on a stock abutment and on the substructure. If we select... When we select something up here, screw retained crown, you'll get this extra window that pops up, and it's asking about the scan body. Is the scan body scanned into or on the arch, or is it a separate scan completely? And in our case, it's a separate scan, so we're going to select that one. It says right here, performed an extra scan with scan body in place. So there's just regular arch scan, and then the scan body scan is separate. If you go down here, this is where you scan the tie base position screw channel manually. This is if you're scanning the tie base. You can also do it that way. It wasn't a choice up here, but I just wanted you to see it was here in the older versions of exocad. This used to be a choice that was included, not on this window because these never used to be here either, but it was a choice when you were deciding if you were going to do implant crown or not, or implant-based restoration or not. So I just wanted to show people that are familiar with it a little bit that it's here now. But I'm going to do it scan body scan separately. I'm not going to mirror. I'm going to say no, I don't want to mirror some anatomy, but I'm going to switch that in the expert mode to show you how to do that. So we'll just select no for now. For adaptation, I want to pull everything down to the margin. I'm not going to do a thimble crown design. We're not going to do virtual gingiva in this process. I'm not going to change any of the parameters right now. And we'll show that again how to do that when you're actually working within the Dental CAD software itself. So I'm just going to go ahead and accept everything here. Click OK. Now this has been changed to an anatomic crown. I didn't mention this yesterday, but I just wanted to show you real quick. If you hold the control button down and click with your left mouse button, it'll change whatever my last thing that I had put in here, last tooth that I designated. However I designated it, it'll change to that. And I can hit control again and add another one, or I can even hold the shift button down, click over here, and then add all of those at one time. That's just a way to add multiple things at one time. I also showed you can left click on a tooth and just drag it over one that's designated something else and it'll change it. So I just changed that, and then I'm going to go over the 6. I'm going to hold shift again. I'm just going to change all those back to nothing because, like I said, we're only doing the one crown on tooth number 8. This is 2 models in occlusion. You would select your shade down here. If you notice, I can't click design. Like I mentioned before, you have to save this job description first. Now I can click on design, so we'll click design. There was previously saves in this on this program, so I'm not going to load a scene file. That's a saved file. I'm going to start with just the scan data because we're going to start from scratch. So we're going to load the scan data. Here it comes. All right, the first thing it's asking me for is it wants to detect the implant position on tooth number 8. So when I click on this, basically I need to tell it what is the scan body that we're using, what brand scan body are we going to use, and I'm going to actually start with just the exocad demo case implant library. We'll click on that. Then it's going to ask me what am I doing here. I want to do a screw retained crown. The next part says, okay, we'll click on the scan body in this position where the little red dot is so we can help locate it and try and match it up. So if I click on that, it's going to bring in this scan body that it's trying to align to. It doesn't line it up perfectly. It never does. So you want to hit best fit matching. It'll actually match it better. Now, if you look at that, I'm going to make it so you can see it a little better. If you look at that, you can kind of tell it's like a multi appearance where it looks, you can see both different colors. That's pretty accurate. The top is more green, which is the scan body scan. I'm not sure if this is a good, perfect match. So what I always do when you go over best fit matching is hold down the control button on your keyboard, click it again, and now you get color mapping to show you how well this is matched together. Blue and green is good, so we've got a really, really good match right here. You can tell with the color mapping. Also, if you notice the edge right here, it's like a 90-degree edge. It's not good. That's not a good match. It's because intraoral scanning or even just digital scanning, it's hard to get 90-degree edges real crisp on the scan, so it's okay that that's off. We're just looking for mostly blue and green to signify that it's a good match. So I'm going to go ahead and click next. Now it wants me to, and we're in the wizard, so this is the easy way to do. I recommend doing everything this way initially, and then you can start switching to the expert mode later on. But it tells you exactly what you're doing. You want to define the emergence profile. So I'm going to go in and I'm going to put 4 dots. Now, if you notice, the gingiva on this model is preconditioned. It's actually in a shape that I want for the tooth. So we're gonna, don't have a lot of work to do on this one, but we need to select 4 adjacent spots. And I like to do it at the 12, the 6, and the 3, and the 9 o'clock positions. And it'll give us its initial proposal. We can click on correct. This is like doing a margin on a crown, but it's the contours. And I'm going to go ahead and just pull some of these down. They're a little bit higher than I want them. Just pull them inside because it is preconditioned. So we're going to kind of use this a little bit. Now you can left click on the line to add a new button if you want. Like that. Pull it in. Oh, that one's way low there. You can also hit free, like we were doing margins, and click, and then just basically draw a whole new line. And it'll put it in there. So that is the emergence profile that we're going to use for now. Actually, and you have this feature right here where you can drop it down in intervals. I'm going to move this up a little bit. And I'm going to move it up to 0.2. And I'm just going to drop it down. If you notice, it's just going to follow the gingiva down a little bit. So it's a little bit more apical. We got a little cross on our buttons here, so we'll have to fix that. Everything else looks good. So that looks good. I'm going to hit next. Now it's going to give me the tooth position. My tooth library right here is default. I'm always set for generic. I'm going to leave it at that. If you look here, these are positioning tools, and this is the one that does the, let me push this down. It's showing you what it does. It's the adaptation to adjacent, and this moves the whole tooth around, but we're actually doing the adaptation to the antagonist, which is the morph anatomy. So if you look on the tongue side, if I move this around, it's changing the crown shape to keep it within the occlusal table. So as I go this way, you can see it's doing everything it can to keep it in. I usually use that when I do this. I like it better. It just makes things a little bit faster for me. Another selection you can do is if you click on this one right here, it'll just move a little bit of an area, a small area that you can adjust. Let me undo that. If you click on this button, it's a little bit larger area that you can move the crown that direction or that way. I'm going to undo that. And then this right here, I actually like this a lot. And I'll show you on the next case where you can use it well. It'll actually section out a horizontal layer and just move that one. So if I grab something on the bottom down here, I can move the bottom there or a little bit lower down here, move just the bottom here, but nothing else is moving. So that if you need to make some fine-tune adjustments, you can click on that. We're doing the morph anatomy. I also talked to you about previously about cut anatomy, and what it does is it cuts the tooth instead of just morphs it down. I like morph better. Or if you don't like either one, you could just do no adaptation, and it's just going to show you how hard it's hitting, because our measurements, you click on up here, our antagonist is giving us a color map opposing. You can also do it for the adjacents for contacts. But that's the color mapping for the contacts between the antagonist. All right. So let me move this tooth into a little bit better position. As I move it down, if I look at the shape, let me turn this over this way. It doesn't really match. I mean, it's really not close. It looks like there's a space here also. If you're going to match the space on the other side, the patient wants it matched on both sides. I would actually, at this point, consider just using this tooth. This is a fine tooth. We can actually take a mirror of this tooth and actually put it in this position to replace this tooth. So the way that you do that is you need to close this window. The way you do that is you click on expert mode. So it closes the window. I'm going to right click and I'm going to scroll down to copy, mirror, or extract a tooth. If we were doing a tooth extraction case, we would do that one. If we're just going to copy mirror, it's the same button, so we'll click on it. And we selected not a copy. Copy would be on the same side, but we want a mirror. So we're going to mirror a direct copy. And we're going to click on the button. If you read this here, it says click on the tooth you want to copy. So I'm going to copy tooth number 9 or 2-1. I'm going to drag it over to the other side. Tooth is already defined. Do I want to replace it? I do. So I'm going to click yes. Now I'm going to position the tooth. I liked the way it's selected. It's selected all the way around. So I can just click past this, and then it's just going to take me back to this window. I'm going to click on wizard and go back in tooth positioning through the wizard. So place the tooth position. So you can play with this however you want. Some people take a lot of time getting it in the right position. I like to get it close. It looks to me like that tooth is just quite a bit smaller than the adjacent teeth. I mean, the space looks bigger here than the space for this tooth does. So there's a little space there. I'm just going to upsize this a little bit, which I'll hold shift and just move it. And I can make it a little bit bigger. Still the same shape. Still has a little space on that side. Take this around a little bit. Just try and get it in a similar position. Get it kind of close. Make mine more solid looking too. All right, so that position's okay there. Oh, let me turn this, rotate this a little bit. There, that's a little bit better. Now I use the lines, I put the grid lines up. That's something that you can do in settings. It also has measurements down on the scale. And if you scroll in, it'll give you millimeter measurements. You can use the grid for measuring things and also for lining things up. So I'll use the line on the grid, drag this down. To it and just kind of line it up. Just they're pretty even. They look good to me. So we'll go with it right there. I'm going to hit next. Now it wants me to do the abutment bottom. So I'm going to hit A to get rid of the antagonist, and I'm going to hit S to get rid of the upper model just so I can see the abutment that I'm working on. And I always look at the tooth that we're putting in and the abutment, like how is the emergence profile. And I think I should take this side in just a little bit because we're going to get a little indentation and it'll make this tooth end up being more square, which will look a little bit different than the adjacent. So I'm just going to hover over that, click on it, and drag that in a little bit. Now I'm going to disconnect it from the gingiva. If it's pink, it's attached to the gingiva. If it's green, you can put it in any dimension. So now I'm going to just take it in. I'm not going to take it any lower, but I'm just going to move it in. And I mentioned this yesterday. If you use your mouse wheel and click on it, it'll put a dot on there and everything is recentered around that for rotation. So you can actually see it. Position of that tooth is really out. So I'm going to back this up just one. I'm going to go back to place the tooth model because I think I got it too far lingually. I'm going to stretch it out a little bit too. Let me put my model back up there. I'm going to tilt it in. That's a little bit better. Emergence profile. Okay, that's matching the other side a little bit better. So I like that. Let me go next. Now it's the abutment bottom. So I can line up the abutments a little bit or the abutment bottom a little bit closer to the crown, which I like. You can also, if you go on the tooth, and you hold the control button down, you can click on it and actually add dots. So you can make, finer adjustments to it. So I'm going to take that in. I'm going to take that in a little bit. Nope, take it in. I'm going to disconnect it from the gingiva too. That one too. So I can slide it in a little bit, slide this one in a little bit. Disconnect that one from the gingiva and slide it in. It's a little bit closer. It's going to keep our shape. This will be all right because this will actually cut in when we merge these two pieces together. So that's okay. I like concave abutments. I believe the literature still says that's the best way to maintain your bone level around your implants, is a concave versus the round bottom on the abutments. You could do that, but you have a big round bottom. But I think for bone level maintenance, it's better if it's a little bit more concave. So that's generally how I do them. Also, under advanced tab here on the abutment bottoms, you can see this lip, which I don't like personally. So I always take this down to nothing just to make it look better. I don't know why the lip's there. All right, so that looks good. The last thing on this page is here, angled screw channels. Now, I'm going to click on draggable because I like the draggable one better. And you can see where the screw channel is going to come out. It's coming out right through the incisal edge. And if it's hard to see, let me just make the tooth a little bit more solid. It's coming right through the incisal edge, which I don't want. So I want to tilt that to the lingual. Now, you can see the arrows, and you can just do a draggable tilt with it. I'm going to click on it, and then I'm going to take it down towards the lingual. And that's a pretty good area. You can go up to 25 degrees, depending on the implant system or the abutment system that you're using. This one's set at 25 degrees. So that looks good. It's coming out the lingual for the screw channel, and it's not going through the incisal edge anymore. I like that. So I've covered all of this. I think that looks pretty good. I'm going to go ahead and hit next. So it's going to merge everything together. Now I get to freeform the restoration. I won't be making changes on the abutment. The abutment is not changeable the way it is, but the crown is changeable. So I'm just going to smooth things down a little bit, give it a little bit better shape. Sometimes you need to add a little bit of material. Let me put the model back up and let me see how it looks on the facial compared to the adjacent. It needs to be a little bit thicker on the apex or apical portion, the cervical line. So I'm going to go to anatomic, where you can grab tooth parts and move them. I'm going to hit tooth parts. I'm just going to pull that out a little bit so it's a little bit more full. And then I'm going to smooth down some of these areas. Like I said, you can spend a lot of time with this section of the software. You can design your own teeth and do a lot of different things. So I'm just smoothing it down. That looks okay. It's a little short to me right there. I'm just going to drag it a little bit further. So I'm going to go anatomic, tooth parts, and just take the whole top part and just move it down a little bit. That looks a little better. All right, I like that. I'm going to go ahead and hit next. I forgot to do the static occlusion and the proximal surfaces. So it'll give you a warning that you hadn't done it. Now, sometimes you don't want to do that. So you'll just ignore the warning. If you hit next again, it'll continue on. But here, I'm going to go ahead and do that. I'll click that, and then the proximal surface, and I'll check down here, because the gingiva, when you do that, it's going to change your abutment bottom here. So let me get rid of the model so you can see. It cuts into the crown. You can see where it cut in the crown a little bit. in this area here and around here. So I'm going to undo that. You can see the areas kind of put a little pressure on the gingiva. If I don't want to adjust those, I want them to stay where they're at because they're supporting the tissue, especially interproximally, so we can try and keep a papilla. I will go ahead and under the proximal, click the button down. I want to exclude selected parts. You get a paintbrush and you can go in here and just paint the areas that you don't want to adjust. There. So got those painted. So they're not going to adjust anymore. There, that looks pretty good. All right. So now I'll hit adjust the proximal surfaces. It's going to adjust the contact. I'll remove the model just to make sure the contact doesn't look like a divot in the side of the tooth. That looks pretty good. It didn't adjust that. I'm going to hit next. Now the whole screw, the screw hole design. The software will give you a screw hole design that has a barrier, like a protection piece around it. I don't like using this. I usually will turn this off and then end up with just a smooth cut hole. If you leave it on and this margin is above the tooth margin, it'll mill out that little section, like right here. It'll mill out a little flat section right there, and I'd rather have the tooth anatomy just be perfectly matched, so I'll turn that off. And then I'll hit next. And it wants to know if you save. Sure, I'm going to save this one. This is good, and this is our prosthetic. Now we can go into freeform. I'm going to do that real quick. Let me hit next. Take the model away. I just want to smooth some of these areas a little bit if I can. Make this. If you hold the shift button and scroll the wheel, you can change the size of these things. So I'm scrolling forward, make it bigger, back to make it smaller, and I'm going to smooth the area. I just want to smooth the crown. Now, if you notice, all I'm smoothing is the crown. I'm smoothing from that margin up. I'm not adjusting this lower section at all. It's non-adjustable. And this is a one-piece restoration that goes all the way to the implant connection. Now, when would you use this? You could conceivably use it if you want to use a connection with zirconia. I don't personally do that. The time that I would use this is if I was doing an immediate implant, and I can screw. We can print this out of use some 3D printing material, print it in our office out of material that's the tissue is actually doesn't respond in a bad way to it. It responds very nicely to it. You just have to make sure it's fully cured and nice and polished, and then we can use a screw and actually put this into the implant for the healing, for the tissue to heal to this, and then later on come back with a permanent, either a metal abutment or a tie base with a zirconia abutment and a crown on top. And we're going to show you that workflow here in a few minutes. But that's one way to do it. Now, if you got to this point, you said, oh, wait a minute, I want to use a tie base. I don't want to go direct to my implant here. Well, you can change this in the software. So I'm going to hit next just to get out of this. Yep, I want to save that. I'm back to this page. I'm going to go to expert mode and hit next. I'm going to hit the A button to get rid of that antagonist. Now you can go to tools. Oh wait, the first thing I need to do is actually, this is a merged restoration. If you notice, there's not a lot of choices here. It is a merged restoration, so I need to deconstruct that. So I'll right click or delete it. So I want to delete that reconstruction. If I look at here, I'm going to delete the merged parts. I'll hit OK. Now when I click on this button, you'll see down here it says switch implant connection. So I don't want to go direct to the implant anymore. I'm going to switch the connection. So I'll click on that button there, and it'll give me some other choices. And my choice that I want to go to is I want to switch here, and this is in the demo version, but but I want to switch the implant connection, so it's going to switch it to a tie base. I'm going to hit OK. And if you look at the restoration, now it stops here because it's actually going to be cemented to a tie base. So I'm going to go ahead and I'm not going to freeform that. I haven't changed anything. I'm going to actually go merge and save that. So I'll go down, I'll skip a couple holes. I like the screw channel that we had previously. So I'm just going to go to merge and save, and it's going to save this restoration. Error, what's the error for? Oh. Cancel. I'm going to go back. Reform it. Okay, that's good. I'm not going to change anything. Now merge and save. Now it does it. So if you scroll here, now you'll see, or rotate this, now you'll see the tie base. So this can cement to your tie base. And again, you could use it for same day of surgery. You can add the tie base to it, and then go ahead and screw it in the mouth and let for immediate load implant case. So that's good. I'm gonna hit OK on that one. We'll go ahead and close this scene, and we're gonna switch gears. I'm not gonna save it. All right, we're gonna switch gears and go to a different case. Now on this case, I'm gonna go to a new. I'm not gonna use a demo case. I'm actually gonna use models that are separate. They don't have a defined job yet. So I'm gonna go ahead and click on client, and we'll just call it a default. No, Dr. Smith is fine. I'll click on the name. We're gonna do, we'll call it, I believe it's number 12 in the US numbering system, which is what, 24 for international. Technician, again, like you can select one if you want. I'm gonna click on number 12. I'm gonna do a anatomic crown, and we'll do it out of zirconia, then I'm gonna go ahead and select over here what type of implant connection we're gonna use. So we're gonna do a custom abutment. And in this one, we're gonna do the custom abutment out of titanium. I'm going to have a separate scan body scan, and I'm not going to copy a tooth this time. I'm going to use a digital tooth. I'm going to pull the margin. And the design thimble crown, no, I'm not going to, and I'm not going to do gingiva. So I'm going to hit OK there. It automatically gave me an antagonist, which is good. So I'm going to go ahead and save it, and then design. Now I'm going to have to pull up some files to actually go get what we need. If you look up here on the upper left-hand side, it says upper jaw scan. So I need to put my upper jaw scan in first. Let me go find it. I'm sorry. Here. Scroll down. I think I have them webinar cases. I think it's in there. Implant 12. We'll use upper jaw right here. Now it wants the scan marker, so marker. And if you notice, it dropped it right in. And then the next thing is the antagonist, so the lower jaw right here. All right, so this is an intraoral scan, and this is the tooth number 12 or tooth 4 that we're going to be working on. And that's a different scan body you'll see. The scan bodies are specific for how you're going to make your abutment. If you're going to mill it out of a preform, say a desk preform or an NT trading preform, then you need the desk scan body or the NT trading scan body. You need to have the scan body match whichever way you're going to manufacture it. This is a true abutment scan body because I'm going to have them mill this abutment for me. And so I have to use their scan body for it. Now, I told you before, when you start moving things around, basically move the orientation. And later on, it's going to be important not to do that. So I'm just going to reset the orientation just to get in the habit of leaving it where it's at. I can see the scan. That's fine. I'm not looking at the red underside. And I'm just going to hit next. For selecting the library, I'm going to click on here and I'm going to go down to true. And it's a Nobel active connection for narrow platforms. So I'm going to click on that. Then it's going to ask me, what am I going to do? Am I going to do a tie base? Am I going to do an angled screw channel on a titanium abutment? Or am I going to just do a titanium abutment? I'm going to do a titanium abutment. Now, this library has not gone through exocad's process of becoming an official library within exocad. But these, and when you come across this, you've got to make sure that wherever you're getting your information from or your data from, that it's actually correct. Now, I've been using this library for years. It's very accurate, it's very correct. So I'm just going to go ahead and use it anyway. So the first thing, like we did before, we have to locate the implant position three-dimensionally in relationship to the teeth. So it says click on right here. Now, if you use hold the right button down, you can actually move this around to kind of see it, because some of the scan bodies will have two flat sides like this, and one is shorter than the other one. So you just got to make sure that you're lining up the right piece. So on this one, they're the same height. So I'm just going to click on this over here. I'm hit click right there. And then I'm going to hit best fit matching. Now it looks like it's kind of close. I do see two different colors, but this is sticking up higher. So I like I said, to use the color matching. So I'm going to go ahead and hit best fit matching again, left click on that, but I'm going to hold the control button down this time. So now I get color mapping, and blue and green is good. You want blue and green. You definitely don't want this as a top color. This is basically telling you that the height of the scan body in the software is different than the scan body in the patient's mouth. So it's going to give you the wrong implant position. If the implant, in this case, it's saying the implant is higher, or because it's an upper jaw, it's technically lower than it really is. If you made your restoration here and then put it in the patient's mouth, you're going to have an open space. You're not going to have any occlusal contact because it's actually not lined up properly. If the scan body aligned and it was a little bit lower instead of taller, or higher up, then when you make your restoration, it's going to be too big. And when you go to put it in the patient's mouth, they're not going to be able to close. You're going to have to do a ton of adjustments to try and get that crown to seat, or for their bite to be correct. So you want to change that. So what you want to do is over here, you want to take this slider bar and take it up a little bit up the side of that, because the tooth or the gingival scan down here is maybe interfering with our alignment a little bit. So we'll take it up. We're only going to align the upper part of this. So now I'm going to go ahead and hit control and click on best fit matching. Actually, I'm going to do it differently. I'm going to show you something. If you click on that, it's going to go back to the yellow color. It looks like it's got a better height match, but I'm not sure yet. If you go into settings, go into tools, go into settings, one of the settings that you have is where it, nope. Where's it at? Just scroll down. Abutment matching always shows distances right here. So I'm going to click on that because I want that to always show the color map. I didn't do that on this software on this computer, but I always have this selected on mine so I don't have to hit control every time. So I'm just going to hit OK. I'm going to hit best fit matching again. There you go. And it lines up and it's showing you the top is perfectly aligned now. It's nice and solid blue on top and you're blue and green everywhere else. So that's a good alignment there. I'll hit next. All right, we need to do the emergence profile again. Now you can go into the software and you can edit this mesh. You can go in, and I'll show you how to edit mesh in some later sessions because we're going to be doing that for our cases. But you can edit the mesh and actually change the shape of this if you want to a little bit. So there's the detection. I'm going to go ahead and hit correct draw like we did previously, and then just change this a little bit. Not too bad. Maybe, yeah, it's not too bad. We can leave it like that. I'm gonna go ahead and hit next. It puts a tooth in there. Now, this is the preform or a preform. I don't like this. It always bothers my view. So I'll go up here to abutments and tie base preform. I'll just go ahead and click on the eye to make that disappear so it's not in the way anymore. So now we're positioning the tooth in its place. If you notice, it's set for movement in all different directions and morph anatomy. And if I look at the occlusal surface, that's actually not in a bad position. I kind of like that. I'd change that a little bit towards the lingual. Tilt it maybe a little bit more. So what I'm going to do is I'm going to click on this section here and just move parts and pieces of this. So I'm going to grab the middle and move it over. I'll grab the bottom and, oh, I need to go a little lower. There we go. Kind of move that over a little bit. I'm going to click on this and move that over also. Grab the middle there, move that in a little bit. That still matches, so it looks pretty good. Make this a little bit more solid. That's a decent spot. I'm gonna go ahead and hit next. Now it wants me to do the abutment bottom. If you notice, I didn't drop the margin down on this one like I did the first one, and when you don't do that, looks like your margins are up a little bit, sometimes high. So what I'll do is I'll go to advanced. I'll eliminate that lip again. I'm going to unstick all, and I'm just going to drop it down by clicking drop down. Make the margin a little bit more subgingival. Let me remove the antagonist. It's not connected anymore. It's the same width. It's just dropping it down a little bit so you'll have a little bit of pressure on the gums. I like that, where that's at. I need to go, I'm gonna hit the S button to make that disappear. And do I like the abutment shape, the bottom part of the abutment shape? It looks pretty good. So I'm gonna go ahead and click next. I could, if I wanted to make it a little bit, like I told you before, wider on the bottom. This is a top angle, so I can make it more fat or more concave. Same here, if you wanted to do it, however you wanted to do it. I'm gonna hit next. Then it goes ahead and puts those two together. Now, I'm going to make some adjustments. Obviously, I don't like the way that looks, so I'm gonna try and smooth that out. Look at the underside. And I'm going to use my mouse wheel to center this again. There we go. Now it'll rotate around that. All right, so I'm going to smooth this down some, make it a little bit smaller, a little bit less strong. A little bit bulbousy in the backside. Take it down a little bit more. If you remember, well, that looks okay the way it is. If you hold the shift button when you're smoothing, it'll just flatten things out way faster. So I like the concavity here. That looks good to me. If I look at the adaptation, I don't have any high spots. I'm going to go ahead and cut all intersections. Let me show you. I'll cut all intersections. I didn't have the model up, but I wanted you to see how it cuts away the gingiva on the bottom part, which you don't want to do. So I'm going to undo that, and then I'm going to go ahead and just select that area again, exclude an area, and I'll just exclude. I'm going to hold the shift button and scroll my mouse to make that bigger. I'm just going to go all the way around the whole bottom of this so it doesn't change the shape, because I want it to be nice and smooth. I don't want it to cut down. That looks good. Now I can hit my proximal cuts. Ooh, I was way bigger on that upper tooth. So I'm going to smooth that down. Let me put my model back on and make sure we're checking that. It's not too bad now. I'm a little bit open on the mesial, so I'm going to drag that over, get a little contact. Now, one of the other things that you can select when you're doing the proximal surface, I need to smooth this side down. So if you notice, it's got a bulbous shape underneath here because I had it positioned too far over. So you can smooth that down to get rid of it, but you're going to want to get rid of it. If you're cementing this crown on this custom abutment, you could probably get the crown on still, even if there is a little piece that goes underneath the contact. If it's a little bit too bulbousy there. But if you're going to screw this in where it goes directly straight in, because the abutment that we selected is engaging, so it's going to fit straight down the hex, you can't have any, on the interproximal areas, you can't have anywhere below the contact that sticks out further than the contact, because it'll never go down. So the way that we deal with that, to make sure that doesn't come up, if we're planning on doing that, let's smooth this. Actually, I'll leave it like that, is when we go to adaptation for the proximal surface, we're going to go ahead and do a disc cut instead. So I'll click on that. It'll bring some discs up for me. And basically, it'll eliminate everything below the contact that would go underneath the contact. So you don't have an area that you lock in. You just have to line this up the right way. So I'm going to drag it over a little bit. I need to rotate it that direction. Drag the whole thing over. That's good right there. That's a good area. And then for the other side, which is where it was actually getting under, drag it over. You can move it this direction to kick the bottom in some, just to make sure. So that looks pretty good right there. Then I'll go ahead and click on the approximation button, or just cut all intersections here again. I'm going to close that window, or take that off. Close that window. There we go. Now there's nothing underneath the contact that's sticking out. So this can go straight down. If you noticed, when I did that, I actually made my, I did the cut around the gingiva again, which I hate doing that. So I'll just smooth it back out real quick instead of backing up and selecting that area like I had previously. Smooth that real quick. Okay, that's better. All right, so we're going to go ahead and hit next. Now it's asking me for the insertion direction of the crown. If I go over the top of this and look straight down, it looks good. I've got no undercuts going straight down. I'm just going to go ahead and hit next because that's in a great spot. Now it's showing me the abutment design, and you can make changes on it. You can smooth things off. You can change the taper if you need to. You can, this is dropped down because I have this down low, so that's why that drops way down. It's giving you the clearance, the occlusal clearance that you need based on your settings. You can add, again, if you go hover over a line, hold the control button down and click, you can add areas that you can adjust this abutment if you want to. I'm making it taller, but moving it forward so there's room there, and you can bring the back up a little bit too. I'm gonna add something here. Drop that down, pick this up. All right, so we're done playing with that. Good. For that's the top part that I was just working on. If you want to click on the bottoms, you can change that stuff again. Also, in the advanced tab, I already got that down to 0. Don't need to move any of the margins or the emergence profile or anything. So I'm just gonna hit next. Now we can freeform the abutment. It's a little pointy on the top here, so I'll usually flatten that down a little bit. There you go. Good enough. Hit next. Now here's my custom abutment. It's a titanium abutment that will screw into the implant. Now, I don't have the crown. The only thing we've done so far is the abutment. If I want to design the superstructure, which I'll click on right there and hit next, it will actually design the crown now. So you want to check your parameters over here, your cement spaces, because we didn't adjust anything in the job description section. It's got a little extra space around it. Cement margin, that all looks good. The borders, these are the borders that I do not prefer. I'm gonna just shrink them up a little bit. That looks good. Click on advanced. Got the diameter of the, because we're milling it, so a little bit bigger than 1 millimeter burr. I'm gonna go ahead and hit next. And it's going to calculate that crown for me. Now we do have a couple of contacts, antagonists, and showing interfering contacts. So we can freeform this restoration. I'm going to go ahead and hit next. I'm just going to pull that margin down a little bit. So I can do it on the ridge. Click on the ridge and pull the ridge down. Pull it down. So it's not too high. There we go. And I'll hit next. Save modifications, yes. I'm going to hit the A button again to get rid of my antagonist. So there is my crown. It's a little bit pointier than the adjacent teeth. You can see the wear is going back towards the patient's mouth. So I would probably adjust that, smooth it down a little bit more. Other than that, it looks decent. Now I'm going to go into expert mode. This is a cement retained custom abutment crown combo. It's made out of a split file system. If I want to actually, I'd mentioned the screw-mentable crown, I can turn this crown abutment combination into a screw retained prosthesis. And the way that I would do that is I need to add a screw hole on the top up here. There's nothing in the software that does that directly, at least not this version. I think they're working on that though. But I'm going to, you can do a workaround and actually put a screw channel there. So we're going to go into expert mode to do this. All right, so I'm in the expert mode. The first thing I want to do is I want to make everything on this page disappear except the screw channel. There's two different ways to do this, and this is the preferred way for me. That's the screw channel. I want to get the merged restoration to go away. So everything's gone. All I see is the screw channel here. So what I'm going to do now is I'm going to right click on the screen. I'm going to save scene. I'm not actually saving the scene. I'm going to save this as just a plain STL. And I'm going to call it screw channel. Screw channel. And I'm going to hit save. Save visible objects only. Yes, that's why I made everything disappear, because I only want to save the screw channel. Hit yes. Now I'm going to minimize this. I'm going to click on Open Explore, this case, wherever it's at. I'm going to click on that. It's going to open it up and explore. There is the screw channel that I just saved. I want to take that screw channel. I'm going to minimize this. I'm going to take that screw channel and I'm going to put it into another Dental CAD window. So it's going to launch another Dental CAD window. All right, so loading tag and scan, no. I'm going to, okay. I need that to move. Let me click on Expert. I'm going to right click and I want to edit the mesh. So I'm going to go ahead and select the entire thing and I'm going to click on Close Holes. When I do that, it closes the hole on the top, closes the hole on the bottom. The reason that you need to do that is you need a watertight file to actually make the screw channel that I'm showing you. And the reason I chose the screw channel, it's in the perfect position. It's perfectly perfectly lined up where you want it at. So I'm good there. I'm happy with this. I'm going to go ahead. You can even hit OK with that. I'm going to right click. I'm going to save again. I'm going to go back to the other location. Where is it at? It's right there. Okay, so I'm going to go to, for here, I'm going to go back to, I got to find the ExoCAD program. Oh, wrong way. I need to go all the way down to C. This PC, Windows, ExoCAD, CAD data, scroll all the way down to the bottom, today's date and 11:06, which was about 3 minutes ago. So this has got to be the file. I'm going to double click on that. I need to change this to a plain STL, which is what the screw channel was. There it is. So it's a screw channel. I'm going to go ahead and hit save. It's going to ask me, do I want to replace it? Yes, I do. So I'm going to hit yes. Yep, just visible objects. So it's just saving that screw channel there. Now I'm going to just close this window. Not going to save it. Close this window. Let me go back into our CAD window. I can make this disappear now. I can bring my merged file up. There we go. Now I want to freeform merged. I'm going to click on attachment. I'm going to subtract the attachment that I'm putting on here. I'm going to click on the library and I scroll all the way to the bottom to load from file. We're in the wrong file. We need to go back to this PC again. We'll go to Windows, ExoCAD, CAD data, scroll all the way down to the bottom, grab the screw channel, bring it in. It brings it in perfectly lined up. And I'm going to, before I do anything, you want to click on allow any changes. You want to make sure you do that, because if you don't, it's going to try and keep the minimal thickness and it will not create a hole. It'll actually be a hole on the top, but then it'll have something underneath it where it doesn't go all the way through. So you want to make sure you click on allow any changes. I'm going to apply that. Hit OK. Yes, I'll save my modification. And now I have a screw hole through my crown that you can cement this before the patient even comes in out of the mouth. Clean up all the extra cement and then you can actually retain it with a screw. Now, why do you want to do that? The reason you'd want to do that is you get something that's called cement sepsis, where if you seat this crown with crown cement and you put too much in, you can push cement up underneath the tissue that will go around the abutment and actually get all the way down to the implant level. Now, I saw a patient last year who had come in from out of state. They had moved to Florida and they were having an issue with their dental implant. So they came into us because their dental implant was moving. So we touched the tooth. We could see that it was moving. I couldn't tell if it was the abutment that was moving or if the implant was moving. The patient just noticed that it was moving. So what we did is we took a radiograph and it looked like a custom abutment with a crown. So I figured the access hole for the abutment's got to be on the occlusal surface. So we actually went in and we found it right away, uncovered the screw, unscrewed the screw, and took out the crown and the abutment. And what we found was a ton of cement around the abutment and around the top of the implant. I touched the implant and pushed on it and it moved. The implant was a failure and had to do with extra cement pushed up all around it, the body's reaction to that. So it's a real thing. Cement sepsis is a real thing. You want to be careful not to overload your crowns when you're seating them with cement. But even better than that would be screwing them in, especially in the posterior. And better than a tie base, I think a custom abutment is going to give you more support on the crown, and because you'll have support over the whole length of the crown, whereas a tie base would be real small and just a little portion of it underneath the crown. It'd be a lot weaker and much more likely to debond in that area than it is here. So that is the end of what we're doing today. We saw a screw retained crown with an angled screw channel. We did a custom abutment with a crown, and then we turned this custom abutment and crown into a screw-mentable crown that you can actually screw retain in the patient's mouth. Our next session is session 3. We're going to be doing multiple implants. We'll do implant bridges. We'll design implant bridges that are either cement retained and screw retained. And we'll start to do a little bit bigger prosthesis where we'll even be doing them on multi-unit abutments, which will transition us into full arch cases in session 4 and 5. I appreciate you coming and watching this presentation. And I hope to see you on the session 3. Thank you so much.